it's me, Dr. Marianne. All right, so we are gonna talk about that weird newborn belly button. What do we do with it? Why does it look so, I don't know, gross? Why is it so, I don't know, wet and gooey? Okay. Your baby's gonna come back with a little umbilical stump attached to it. Okay, fine. It is going to shrivel up in the first couple days, and it's going to be kind of like a dead appendage that's gonna walk around with your baby. Okay, now it's not gonna stay forever. It's not meant to. This is how to care for that belly button in the first couple weeks until it falls off. Now, first, the belly button will fall off anywhere from the first 24 hours of life up until day 30. The average is somewhere 10 to 14 days. That's the average. You don't need to do anything fancy or go out of your way to apply alcohol to it. What you should do, however, is try to keep it as dry as possible. Now, if it gets a little bit wet, it's no big deal, nothing's going to happen, but the drier you keep that belly button, the quicker it's gonna fall off. So what to expect as it's falling off in the separation process. So the belly button doesn't just like fall off one day. It is going to slowly peel itself away from the body and then fall off. During that separation process, it will bleed. So if you find blood one day all over, well, not all over the abdomen, but if you find blood surrounding the umbilical cord, maybe on the onesie, kind of on the diaper, that is totally normal. It is painless to the baby, so don't worry too much about that. And then also, as it's peeling away from the skin, underneath the part that's separated, it will look wet and gooey and mucousy and pretty gross. There also might be a little smell to it, and that's okay too. This is all normal. And then it's slowly gonna peel off. Remember, blood, gooey, wet, yellow, gunky, and then bam, it's still gonna be wet and gooey. However, that is the point where you can do a full bath. Before the separation, you just wanna do a sponge bath. Again, you want to keep that as dry as possible. Once it falls off, game on, bring out that baby tub. Time for first bath, which is always so fun. Your baby will usually love a bath, so it's kind of exciting for both of you. It will still take a few days for it to look like a normal belly button, but it will eventually look like a normal belly button. And yeah, your baby will be free of, you know, dead carcass attached to it. Now, how can you tell if something is a little wrong with the belly button? So if it looks wrong and that's normal, how do you know if something's actually wrong? So there is a small chance of infection of the belly button. So to differentiate between normal weirdness and abnormal weirdness is you want to watch for redness and swelling around the belly button cord or tenderness to touch. So if there is the bleeding and the yellow goo and all that stuff, however, the surrounding skin is also very red, very inflamed, and very swollen, that's when you want to call your doctor right away. You might need a short course of antibiotics to clear that.